In the last 24 hours, we have confirmed 64 new cases of COVID-19, bringing the total number of cases in Alberta to 754. This number of 754 includes 77 cases involving healthcare workers, including staff in continuing care facilities. The vast majority of these cases were returning travelers or participants at the bonspiel that I have previously talked about, not cases that were acquired while they were providing care. We continue to refine reporting for healthcare workers, and we will report new information as it becomes available. Sadly, I was just informed of an additional death reported in Calgary Zone at Mackenzie Town Long-Term Care. On behalf of all Albertans, I convey condolences to this individual's family. This is another tragic case of COVID-19 at its worst. Alberta Health is tracking outbreaks in 3 facilities at the moment: Mackenzie Town Long-Term Care and Care West Glenmore Park Centre, both in Calgary, and Shepherd's Care Kensington and Edmonton Zone. Updates on confirmed case numbers at these outbreaks will be provided tomorrow to ensure we have the most accurate information available. These outbreaks remain worrisome. We know seniors and those with chronic health conditions are at greatest risk of severe illness related to COVID-19. We must all continue to do our part and follow the public health orders that are in place to save lives. There are guidelines for outbreak control that include, ideally, in any long-term care, continuing care setting, if you have any resident or staff member who is showing any symptoms, first of all, the staff member would not be allowed to come to work. There are daily symptom checks that are required for long-term care. If there is a resident who experiences symptoms that are related to COVID-19, which also could be related to other viruses, then they should be immediately isolated in their room. And there are protocols with respect to testing and making sure that we quickly identify if that is a case of COVID. In the case of Mackenzie Town, unfortunately, that outbreak protocol seems to not have been implemented immediately, so there does seem to have been a significant amount of exposure. And so really the critical piece of response in that particular outbreak is making sure that everything is done to prevent any further exposure. So any residents who are feeling ill are kept in their rooms and make sure that they are not interacting with others. Any staff members who are ill are kept at home. Staff members who were exposed are allowed to work in that facility in order to keep that facility open and running, because we know that it's important for residents to have that care, but they must wear masks while providing care, and they must not work in any other facility during this time of outbreak at that particular location. And so again, it's really about making sure that residents are separated as much as possible, and this is extremely difficult. And we know that the ability to socialize is an important part of our overall health, but for this time period, those residents are not allowed to gather in groupings. Dining halls are being kept separated in terms of the number of people who can even sit together. Common use items are, for example, like a salt shaker, are not being allowed if multiple people would touch them. So there's multiple things that are put in place in these facilities to try to stop any additional spread.
There has been, as I've said several times, an incredible amount of planning ongoing within Alberta Health Services to prepare for what we anticipate to be an increasing number of individuals who will require care, both in the hospital but potentially in the community as well. We are looking at all potential opportunities. I can't give you an exact number as to how many beds are open today, but I can tell you that healthcare workers who have been in the system for many years are telling me that they've never seen as many beds open in our facilities as there are right now. So we are identifying between now and April 15th, a total of 2,250 beds that we will have ready for use in the event that we need them. And in fact, we are now going beyond that capacity as well. We are also looking at other opportunities because there will be a variety of types of care that will be required. As we've talked about previously, some individuals require an assessment and a nasal swab in order to diagnose COVID-19. Others may require a more substantial health assessment assessment, or perhaps if they were diagnosed with COVID-19 2 or 3 or 4 days ago and have concerns about increasing symptoms, they may require a new health assessment. In that case, we are setting up what we're calling secondary assessment centers that will be available to examine and assess individuals to see if they're safely managed at home or whether potentially they might require other levels of care. There will be facilities to monitor individuals for a number of hours in order to help make that decision.